The skeleton, chapter 7, part 2. Now, today we're going to cover the rest of our bones, and we're going to start with the spine and the spinal column, and then go from there. So from the skull to the pelvis, we have about 26 irregular bones called the vertebrae, the vertebral column. Okay, and ultimately that vertebral column is designed to carry that weight and transmit it to the lower limbs that hold all of your body weight. Also, it is designed to surround and protect your spinal cord, and it provides attachment for your ribs and your muscles, and it has a flexible curvature. Our vertebral column has 5 major regions. The cervical has 7 vertebrae, the thoracic 12, the lumbar 5. A really good way to remember this is at 7 a.m. we have breakfast, at 12 we have lunch, and at 5 p.m. we have dinner. So 7 a.m., 7 cervical vertebrae, 12 p.m. for lunch, 12 thoracic vertebrae, 5 p.m. dinner, 5 lumbar vertebrae. Now there's more. There's the sacrum, which is down here. Okay. The sacrum is actually several fused bones, and there's 1, 2, 3, and 4, and 5 fused bones. Okay, right after that is the coccyx bone, which is your tailbone. And if we look at the lateral view, I want you to pay attention to the curvature. So obviously the head is right up here. So this is the C1. Okay, C1 to C7, right? And it makes a concave type of curvature. Okay, and then the thoracic column, the T1 to T12, makes a convex curvature. So basically it's sticking outward. And then the lumbar is also concave. So concave, convex, concave. Technically, I guess this would be convex, the sacrum and coccyx bone. Okay, and of course we have the intervertebral discs. All right, now this is a closer look at the spinal cord inside of the vertebral column. Now, I just want to make a couple of things very, very clear. Let's see. See now, just a little tiny bit. Let's actually move to this image. Now, this is the typical vertebrae structure. Notice that it has a body and it has the spinous process that sticks out. These will stick out to the side. Transverse process, transverse, and that's what transverse means. It means side to side. Okay. The lamina is this region. The pedicle here and here. The superior articulate facet. the vertebral foramen. Okay, you want to know all of the bone markings. The first vertebrae is called the C1, also referred to as the atlas. And it actually doesn't have a spinous process, and it's one of the very few that don't. It has this little tubercle, okay? And then it does have transverse processes. They're just in a different location versus the other vertebrae we were looking at. And notice that these faucets here and here is where the occipital lobe is going to sit, there and there in those faucets. The next vertebrae, the second one, is called the axis. And this allows you to turn your neck because of this, called the dens. Now, when we're looking at individual vertebrae, you have to be able to identify a cervical, thoracic, and lumbar. And the way you do that is you look at the vertebrae itself. And the cervical vertebrae has a triangular shaped foramen and a skinny little body, and the spinous process is very different than the spinous process over here. This one protrudes out, this one makes this kind of V shape inwards. Okay, but the body's also thin. Okay, the thoracic, we know that this is the thoracic because the body is thick and it's shaped like a heart. And the vertebral foramen is a perfect circle, has the spinous process, the transverse process. These are facets where the ribs connect on both sides. Okay, the lumbar, it has a triangular foramen as well, similar to the cervical, but the body is thicker, significantly thicker. And you can see that here. See this body versus this big lumbar. All right, so you want to know the characteristics of each and all of the bone markings of each. Now the sacrum is 5 fused bones. So it is believed that they were some type of vertebrae that eventually fused. And that's exactly what's happening here. That's why you still see these foramens, because they belong to a vertebral-like structure. All right, so let's take a look. So all these little foramens are called the posterior sacral foramen. Okay, these little ridges that are sticking out, median sacral crest, sacral canal. Inside of there, this is the body. Okay, let's see, what are we looking for here? Okay. This is the lateral sacral crest on this side, and there's one on this side too. Very good. Sacral hiatus. This kind of empty space right there. Okay. The last of the lumbar connect here. And here, of course. Each tip. If we look at this like a triangle, which it is, okay, the corners of that triangle are referred to as the ulna. And then, of course, don't forget the coccyx bone down here, which is 1, 2, 3, 4 small bones fused together. Our thoracic cage is quite interesting. Ultimately, it consists of the sternum and the ribs. Now, our sternum is going to play a big role in this cage because notice that ribs connect on one side to the vertebral column and they wrap around and connect on to the sternum. Here, 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 all the way around it. In fact, all of the true ribs, 1 through 7, articulate with both the vertebral column and the sternum, and then the false ribs do not. They articulate with cartilage, and then we have 2 floating ribs. Now, ultimately, this cage is designed to protect your most vital organs, the lungs and the heart. And then, of course, it's going to be, all of our bones are there as sites for muscle attachment and protection. Okay, let's take a look at the sternum. Now, the sternum is this dagger-shaped bone. And it's actually 3 bones in one that have been fused together. The top part of the sternum is called the manubrium. The middle is the body. The lower part is the xiphoid process. Okay. See this little indentation or depression? Okay, that is called the jugular notch. That's in the center. Okay, see how it gets flat on this side and this side? Clavicular notch. That's where the clavicle will join. Okay, then we have several joints here. Because the manubrium and body connect, that's the sternal angle. Because the xiphoid process and body connect here, this is the xiphosternal joint. Okay, you definitely want to know all of those markings. Okay, parts of the rib. The rib's easy. It has this perfect curvature. Okay, and ribs, most of them anyway, articulate on one side to the vertebrae. On the other side, it's going to connect to the sternum. And so we do technically have a shaft, a head, a neck, and tubercle for the rib. Okay, you'll see the head of the rib connected to the sternum. I'm sorry, the thoracic. The head is connected to the vertebral column. Okay, the neck is always under the head. The tubercle of the rib is just this little tiny thing sticking out right there. Okay, the shaft, that's obvious. The angle, see how it curves, angle of the rib, nothing shocking there, right? Okay, shaft, and then connects to the sternum, done. This is another view to show you how it would look. If we're looking straight down, this is what it would look like. So this is sticking outwards. Okay, this would be facing your body. So the body's here. Your organs are here. Okay, so obviously this will wrap around and connect and protect the organs that are in here. So it's just to help you see it from different angles. Okay, and this is an isolated rib, and of course the head and neck. So once you see the head, you know that it's going to connect at the vertebrae there, and then this is the sternal end. The junction with the sternum or the costal cartilage. All right, let's take a look at the pectoral girdle and then the pelvic girdle. Okay, so we're going to watch the movement of the pectoral girdle.
The pectoral girdle refers to the bony arch formed by the clavicle and the scapula. The primary function of the pectoral girdle is to act as an attachment point for the muscles that provide arm movement at the shoulder joint. It also provides the only connection between the arm and the axial skeleton.
Okay, taking a look at the pectoral girdle, this is our shoulder blade connected to our clavicle, which is our collarbone, and together, along with ligaments, tendons, muscles, we connect the clavicle. Okay, this bone right here, your collarbone, with the shoulder blade. You can see most of it. Obviously, it's your shoulder blade, so it's going to be behind the ribs. And then, of course, it will connect your humerus bone, which is your upper arm. Okay, so together, those are going to make up the girdle. Now, the clavicles, you have two clavicles. They're S-shaped. And one end articulates with the sternum, and it's called the sternal end. And one end articulates with the acromial end of the scapula, and it's called the acromial end. Very, very easy. So look for this blunt side. The blunt side connects to the sternal end. This rounded side connects to the scapula. Okay, now muscles are going to be involved that help hold everything together that we don't see here in this lecture, but we'll see in upcoming muscle lectures. This is a closer look at the clavicle. This is the superior view. This is the inferior view. So if we look at the other side, we'll see quite a bit. We can see the acromial end. Okay, we can see the acromial end and the sternal end even better, and we can see more. We can see where the traps connect. There's 3 locations where the trapezoid muscle connects. And then we see this protrusion called the conoid tubercle. Okay, the scapula is the shoulder blades. There's 2, of course. They're thin, triangular, flat. And of course, they're going to be on the dorsal side of the rib cage between ribs 2 and 7. Okay, each scapula has 3 borders. The superior, medial, and lateral. Okay, superior is the higher border. Okay, so technically this would be this shoulder. It would be the right shoulder. Okay, the humerus would connect here in the glenoid cavity. Okay, so this is the superior border. Lateral border. And medial border, closest to the midline. Okay, now that's that. All right, now a couple of more important markings are the glenoid cavity. Let's see if we can get a better picture of the glenoid cavity. No, I don't have a better picture. That's okay. The glenoid cavity right here. So it's a pretty shallow cavity, therefore the humerus bone tends to fall out of socket quite a bit with people that are athletic or overusage. Sometimes it's genetic. Sometimes it just happens without real, if there's a strain or something like that. Okay, now if we look closer, I want you to notice this end that's called the acromion, the suprascapular notch, and this little guy right here, the coracoid process. Okay, now if we flip this over, there's the notch, the suprascapular, there's the coracoid process, there's the acromion, glenoid cavity, and see this branch type structure? It's referred to as the spine. So it's unsurprising. This is called the supraspinous fossa, inferior spinous fossa. It's based on the location of the spine. Okay, the upper limbs have 30 bones. Okay, for each upper limb. So we have a humerus for the upper arm, the radius, the ulna, 8 carpal bones, 5 metacarpals, 14 phalanges. Okay, the humerus. Okay, the humerus is your upper arm. And a good way to remember this is it makes up your shoulder joint. And so if you've ever bumped your shoulder, your elbow joint, not your shoulder joint. If you've ever bumped your elbow and you get that kind of numb feeling, and people refer to it as your funny bone, that is a great way to remember humerus. The humerus bone, because of bumping your elbow and that old term funny bone, right? Humerus, funny, got it. Okay, now let's focus on the markings that we need to know. We want to know the head of the humerus. That's not hard to identify, head. Okay, the neck, yes, the head is not, extremely, it's not this deep socket, ball and socket type. It's a small ball, unlike the femur, but it's still a head. And what comes right after a head or right below a head is the neck. Okay, you want the neck, and then you want the greater tubercle, which is right there or there, depending on which way you're viewing it. Notice that this part right here is referred to as the surgical neck. Okay. Now, if we're looking this way at the anterior view, see that little protrusion, deltoid tuberosity. Okay, the condyles. Let's start from the condylar ridge. Lateral condylar, a supracondylar ridge right here. Okay, and then it's going to connect into condyles. So there's a medial condyle on each side, and we can't exactly see it right here, but we can see it here, a lateral epicondyle. All right, and then this kind of round perfect circle is called the capitellum. Radial fossa, right there. Coronoid fossa, right there. Now, if we were to flip this over and look at the posterior view, see this perfect circle, and right above the trochlea is called the olecranon fossa. Right there, right there. Very good. Now you want to take the humerus bone and learn all the markings from it that we have in our list. here's a closer look at the olecranon fossa, and notice that our bones for the forearm are already brought into this image here. Now let's take a look at how they're connected. Okay, so this is the humerus bone up here, right? And we know that it articulates and makes your elbow joint. And this is the elbow joint. The humerus articulates with the head of the radius. Where the capitellum is, that's what connects to the radius. And the radius has a perfect circular head. Makes a perfect circle. And a good way to remember the radius bone is if you look at it and you see that perfect circle. Remember, half of a circle, half the diameter of a circle is radius. Let me try to do a better circle. There we go. Okay, remember, half. Radius is half of a circle. In math, right? So that's how you identify the radius. It has this perfect circle. Of course, that's the head, the neck, and right next to it, which also helps make up your forearm, is the other bone, the ulna. And this is the ulna here. But if we look at this picture, the posterior end of the elbow, you see that the ulna is hooked. See this little area right here? It's hooked into the olecranon fossa. It's called the olecranon fossa because this part of the ulna is called the olecranon. Okay, the radius. Okay, the radius connects to the thumb. So no matter what, it's going to articulate with the thumb. Okay, but it does have a perfectly round head. Underneath that would be a neck. It has this protrusion called the radial tuberosity, and then down here is called the radial styloid process. It's this little kind of point. There it is. And then we have our ulnar notch. And it's just where the ulna and radius connect. The ulna, the olecranon on this side, the coracoid process on this side, okay? And ultimately, if you look at the ulna and it's isolated, it makes a U for ulna. Okay, the bone features we want to know. Okay, maybe I zoomed in a little bit too much here. Okay, there we go. All right, isolating the ulna. There we go. Okay, now I want to kind of disregard the radius for a second and just focus on the ulna from both angles. Okay, we'll start from the top. Olecranon. That's this part that hooks into the olecranon fossa. The trochlear notch. See this line right there? See that little line? That's the trochlear notch. Okay. There we go. There's the trochlear notch even more closer. There we go. That's a better view. All right. And then in that U, remember U for ulna, olecranon, trochlear notch. See this little peak, coronoid process. See this smooth area right here? Radial notch, because that's where the radius will connect. Okay, and what else do we have here? Da, 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 da. Okay, I mean, this is the same thing. It's just the joint where the radius meets the ulna. Okay, down here, the radius meets the ulna again in the ulnar notch of the radius. And then this is the head of the ulna down here, and the ulnar styloid process. That's a good one. There's the ulnar styloid process, the ulnar notch. Okay, let's go ahead and move on. Now, the bones of the hand. So, this is your radius bone, ulna. Notice that the radius is going to be connected to your thumb. Okay, now you want to learn these bones. And all of your carpals, think of carpal tunnel. Okay, we can learn them. We can learn them this way in rows. Okay, or we can learn them this way. I like to learn them this way, or teach them this way in 2 rows. Okay. So let's go ahead and start. All right. Let's start from the thumb, and then we'll move inward. So, closest to the radius, the scaphoid. Next, lunate. Triquetrum. Pisiform. Okay, next row. Trapezium. Trapezoid. Capitate. Hamate. Okay, and then, of course, these are your carpals. Okay, metacarpals 1 through 5, and then phalanges, distal, proximal, and middle. Okay, the next is the pelvic girdle. The pelvic girdle is the hip girdle. It has 2 hip bones, or coccyx bones, and a sacrum. And it's very stable. It's more stable than any other joint. And ultimately, we're going to start with the hip bone, which is 3 fused bones. The ilium in yellow, the ischium, and the pubis. Okay. Now, if we look closely at this pelvic girdle, these are several bones that are connected. This is 1 hip bone over here. Okay, I'm outlining one hip bone. Not doing a great job, but it is what it is. That's one hip bone. This is the sacrum and coccyx bone down over here. And then, of course, this whole thing is the other hip bone. Okay, now this makes up your pelvic girdle. These two hip bones, they articulate at the sacroilio joint, meaning the sacrum and ilium connect right there. So you want to know that joint. Notice that the ilium has this crest called the iliac crest, and it's got this weird kind of, it almost looks rough because it feels that way. Iliac crest. Okay, from this perspective, you can see the ilium is pretty smoothed out. The pubis on this side, this whole thing, and then this part down here is the ischium. Okay, so the two hip bones are connected to the sacrum on one side, and then the pubic arch, or I'm sorry, the pubic symphysis on the other side. And then here we have the pubic arch. Okay, so okay, and that pubic symphysis is made out of cartilage. All right, let's look at more bone markings. Anterior superior iliac spine. See this whole thing? You want to know that. Pelvic brim. Acetabellum. That is where the femur bone sits in this perfect ball and socket joint. Okay? This little tiny protrusion, pubic tubercle, pubic crest, pubic symphysis. All right, now we have a lateral view of the right hip and then a medial view of the right hip bone, and I want to point out some important factors here. Okay, let's figure out where we are. There's the ilium, pubis, ischium. Okay, so on this side it's turned this way, and this is this way. Okay, the acetabellum's right there. That's where the femur bone connects. Okay, and then we can see the anterior superior iliac spine. The posterior superior iliac spine is going to be on the opposite end of that. Or, yeah. Okay, and then if we follow this down, this notch is the greater sciatic notch. Okay, this is moving us down into the ischium. This is the body. It has a little tiny spine that sticks out. And then it has a lesser notch. So this one's called the greater notch. This one's called the lesser notch. Well, the lesser sciatic notch. Let's be specific. Okay, this weird rough kind of part is called the ischial tuberosity. Okay, and this kind of curved area is the ischial ramus. Okay, this space is the obturator foramen. Inferior pubic ramus. So ramus is always kind of this kind of curve type thing. Pubic body, and then again the acetabellum, perfect for that joint. comparing the male and female pelvis is quite significant when scientists discover bones. Paleontologists, anthropologists, the first thing they look for is the pelvic girdle. If they have it and if they've acquired it, they can figure out if it's a male or female just by looking at the pelvic girdle, because the female body is designed for childbearing, and that's just a fact. And so the hips are broader and the pubic arch is broader. It's more at a 90-degree angle. Now, the male body doesn't have those capabilities, right? So basically, their body's going to be heavier, and so their entire structure is different. But their pubic arch is specifically going to be more acute, about 50 to 60 degrees. And that is how they can immediately tell the difference between a female and male specimen. Okay, the lower limb carries all of the weight of your body. That's not surprising. It mostly falls on to this bone, your tibia. So we're going to look at the thigh, the leg, and the foot, and really what that really means in our anatomy class is the femur. That's the biggest bone in your body, the tibia, the fibula, and the foot. And I'll go into the details of that. Now I want to point out something important here in this image. Okay, so here's our hip bone, and there's the head of the femur sitting right into the acetabellum, exactly where it should be, and it's in there pretty good. This is a strong joint. If any joint is strong, this is the strongest, one of the stronger ones actually. There's definitely stronger joints, but this is the one that gets utilized and it is quite tough. Now I want to go over the femur. Okay, now the femur, it's going to have this head. And that head fits right into the acetabellum. And then, of course, it has a neck. Okay, then it has the greater and the lesser trochanter. Of course, this is called the intertrochanteric crest. Let's move down. Gluteal tuberosity, this line. All right, medial and lateral supracondylar lines. That just simply means that we see these lines because they're going to eventually connect to these condyles or epicondyles. Okay, and indeed, they do turn into the medial epicondyle of the femur and the lateral epicondyle of the femur. And in between the two, we have the inner condylar fossa, which is this perfectly circular marking right there. And if we look at the anterior view, you'll see the patellar surface. Patella, that's your kneecap. And that is where the knee is going to articulate. Okay, so if we were looking at this, there's our our femur bone connected. There's our kneecap. Not too much to really go over on the patella. You do want to know that it's called the patella. It does have this kind of triangular sesamoid shape. And so the tip is going to be referred to as the apex. The other side of it, of course, connects to the femur, you know, facets for the femur and things like that. I'm not too concerned with those. All right, the tibia. The tibia is a strong bone because it carries all of our weight. This is your shin bone. So if you've ever been kicked in the shins or ran into something and hurt your shin bone, you've hurt your tibia bone. Technically, all of the weight from the human body, from the upper body, sits right onto this bone, causing quite a bit of strain over time, depending on how healthy the individual is. Now, right next to it, as a supportive bone, is the fibula. Now, don't mix up tibia with fibula. They're completely different. This is your shin bone. This is just a supportive bone that's still important, but it doesn't carry any weight. All right, let's take a look at the tibia itself. Okay, the bone markings that we want to focus on. Okay, now notice that the tibia, it has these two surfaces that are nice and smooth. This is where your knee joint is formed. The femur bone will connect here and here. And then, of course, the patella will cover both. Now, so it's unsurprising that these are both named for exactly what they do. Articular surface of medial condyle. Medial condyle of the femur. Articular just means they connect. The joint surface of the medial condyle here. Joint surface of the lateral condyle. So this is going to be towards the middle of the body. This is on the outside, right? Okay, so the lateral condyle. Okay, femur connects. Now let's take a look at this is the front view. So let's look at the front view. Notice that you can see these little, see those little protrusions sticking out right here? Those little spikes kind of, those are called the intercondylar eminence. Okay, you could see it here as well, right there. Those two little peaks there and there. All right, now on the tibia, that belongs to the tibia, is a lateral condyle, and it's right above the fibula. Okay, now on this side is the medial condyle. Okay, this bulge, tibial tuberosity. Down here, see this little peak? Medial malleus. Okay, and this is just surface that's going to connect to the ankle joint. Inferior articular surface. The fibula has a head, and where it connects to the tibia is called the superior tibiofibular joint. And there's also an inferior tibiofibular joint, and that's where they connect down here. So they connect up here, the tibia and fibula, and down here. Up here is going to be the knee joint. Down here, we're going to connect to the ankle. Now, as for bone markings, for the fibula, really for this one, we just need to know, of course, where it articulates with the tibia. Okay, so that superior tibiofibular joint, the head, and the inferior tibiofibular joint, and the lateral malleolus. Malleolus. Okay. All right, now notice that there's a medial malleolus on the tibia, and it's just this kind of pointy end. And then there's a lateral one on the fibula. Okay, your tibia is your shin, your fibula, it supports your shin bone. And here you can see really well the lateral condyle, the tibial tuberosity. If we flip this around, you can see where the femur will connect here and here to make up your knee joint. Now, bones of the foot. The bones of the foot are not too difficult, but we do need to know them. And the good thing is that the foot has phalanges, distal, middle, and proximal, and metatarsals. So don't mix up carpal and tarsal. Okay, the tarsals are the ankle bones. And we do need to know the ankle bones. Okay, the biggest one, calcaneus. Okay. Let's see, calcaneus is down here. That's actually a better picture, calcaneus. Okay, talus, navicular bone, cuneiform, medial cuneiform bone, intermediate cuneiform bone. And then over here, lateral cuneiform bone. So all of these bones are fairly easy. Don't forget the cuboid bone. Okay, so if we start from the back, it would be calcaneus, talus, okay, cuboid, navicular, okay, and then it would be medial cuneiform, intermediate cuneiform, lateral cuneiform, and cuboid, and then metatarsals, phalanges, proximal, middle, distal. All right, so you definitely want to get your pictures from online, that from our class from Canvas, and start labeling all of the bone markings and get started on that. This is another view of the foot. Okay, now the last thing we're going to talk about in this chapter is the skull of a newborn. Newborn babies are not born with a completely formed skull. Of course, they're not born with completely formed organs, brains, or body parts, right? So it's not shocking that they're born with these soft, unossified remnants of fibrous membrane called fontanelles. And this allows the brain to grow. It allows the birthing process to occur easier or quicker without damage. And we have 4 fontanelles as a newborn. Okay, the anterior fontanelle. Okay. Posterior fontanelle, and that's going to be between the 2 parietal bones and the occipital bone. Okay. The mastoid fontanelle, right behind the temporal bone and between the temporal, occipital, and parietal bone. Okay, and then the sphenoid fontanelle. And then after the brain grows and the skull grows and the individual grows, then all of these become sutures. Sutures, and oh, I can't even draw it for some reason. These get sutured up, and they're held together with some of our strongest cartilage, but the skull will eventually get there. Okay, so you want to know everything we've covered in this lecture, and pay close attention to your study guide, and good luck. I'll see you in the next lecture.